Sabrina Panetta, and this is my patient. So is it okay if I palpate you today? Thanks. All right, so we're going to start off at the sternal notch, and we're going to move down to the manubrium, and then we're going to continue going down, which is called the body, and then right here is called the xiphoid process. So now we're going to talk about the different ribs. We have ribs 5 through 12. Yes, 5 through 12. And at the bottom here we have rib 12. It's bilaterally. So this is rib 12, rib 11, 10, 9, 8, 7, 6, and 5. So they all go down, and that's the rib cage. Next, we're going to talk about the ilium. So the bottom here we have the iliac crest, and then in the front, if I feel, this is also bilaterally, there is the anterior superior iliac spine, and when I turn you around, we have the posterior and the the posterior superior iliac spine, which is these two little back dimples. And if I go together, that's going to be on S2, and that is where the sacrum is. So now we're going to talk about the thoracic vertebrae and the lumbar vertebrae. So for the thoracic vertebrae, can you just put your head down for me really quick? So this is C7. So you can count it. There's a couple of ways. There's anatomical landmarks. The way I like to do it is, this is C7, this is T1, this is T2. So T2 is an anatomical landmark, and you can find that by following the line of the scapula. So right now I'm touching the spinous processes, and then on either side is the transverse processes. So this is T2, T3, T4, and also spinous process of T1, T2, T3 is following 4, 5, 6, 7, and then the seventh thoracic vertebrae, that one lines up with the inferior angle of the scapula. And then as I keep going down, so this is 7, 8, 9, 10, 11, and 12. 12, it corresponds to the 12th rib. So if I feel down and I go upwards, it'll meet up at T12. And again, on either side, so you can count them going down. So this is the transverse process for T1, T2, T3, and so those are the transverse processes, and on top is the spinous processes. So now we have the lumbar spine, and then an anatomical landmark for that would be the iliac crest. So if I put my hands here and I move in, we have L2. And so we can go up to L1. Again, the spinous processes are on either side. I'm on the spinous process right now. We can go down to L2, L3, L4, L5. L stands for lumbar, and then T stands for transverse. I don't know if we're allowed to use acronyms or not, so that's why I said that. So now I'm going to talk about facet joints, because there is one on each vertebrae. So facet joints, they're synovial joints, and they're between the pedicle, I'm sorry, I don't know how to pronounce that, and the lamina of the same vertebrae. So in each vertebrae there is one. And so for this, we're going to talk about the thoracic and the lumbar spine. So for these facet joints, it's responsible for flexion extension, which is in the sagittal plane, which is in the frontal axis. And then we have rotation for the facet joints, and that's in the transverse plane. which is the vertical axis, and then lateral flexion, which is in the frontal plane of the sagittal axis. So next we're going to talk about the sacroiliac joint. That's down here. And this is a non-axial point, but it does have a gliding motion. So I'm sorry, I don't think your belt's kind of in the way. So it's between the sacroiliac, the sacrum, and the ilium are right here, and like a butterfly. I don't know why I'm pointing on myself. Anyways, so now we're going to move on to different connective tissues. Okay, so what's the best way to do this? All right, so we have, there's two that run on the, all the 33 vertebrae. So we have our anterior longitudinal ligament. So that's in the front, which is on the front of the vertebrae. So it's not technically on the sternum, but it's just in the anterior of the vertebrae. And then we have the posterior why is that word so hard? Longitudinal. Thank you, ligament. And that is down the 33 vertebrae. So next up we have the, this one is yellow. It's Ligitium flavum, and that runs between the laminae of the successive vertebrae. So that's right here. And then we have our, just one more, a supraspinous ligament, and that is on the dorsal lips of each vertebrae. And so it's this, it is from the occipital bone down to the coccyx. There's a better way to say that. It's from the dorsal lips of each ligament, spinous process, from the coccyx to the external occipital protuberance of the occipital bone. That's what I want to say. So between each vertebrae, we have our intervertebral disc, and those act as shock absorbers, and there's one other function for them. I'll come back to the different function. We also have the linea alba, and it's like a line. Why am I doing it on myself? It's a line from down the belly button. Sorry, it goes down from the sternum, I believe, to the belly button. And it's most predominant on like a pregnant woman. You can see the line going down. For the intervertebral disc, there's shock absorbers and they're spacers. That's what they are. Sorry. The pubic symphysis, I can't really palpate, but it's on the pubis right here, and it's like it's just like a little disc between the pubis. Sorry, I don't want to touch you. And so on your back, there's like a diamond shape, and that is called the thoracolumnar fascia. I'm sorry if I pronounced that wrong. But it's this diamond on the back, thoracolumnar fascia. Okay, so now we're going to move on to the different muscles. Okay, so I'm going to ask you to move right here and step. Thank you. Okay, so we're going to, we're going to talk about the rectus abdominis. And so That originates at the pubic symphysis, which is down here, and then it goes in. So it originates at the pubic symphysis, and it inserts at ribs 5 and 7. So 5 and 7. So 7 would be about here, and then 5 is here, and the sternum. And its primary movement is trunk flexion. Next, we have our internal oblique, and that originates at the anterior iliac crest, so that's bilaterally, and the thoracolumnar fascia. I think I said that right. So that's again on the back, shaped like a diamond. That did not make a diamond shape. So that's the origin, and then it inserts on ribs 12 through 9, and also on the linea alba. And now that is responsible for lateral flexion, rotation, and trunk flexion. Moving down my mental list, we have the quadrium laborium, and that originates on the iliac crest, and it inserts at the 12th rib, and also on the lumbar spine through L1 to L4, transverse processes. And that's responsible for hip elevation, trunk extension, and trunk lateral flexion. So now we have transverse abdominis, and that is the inner aspect of the last 6 ribs. So it starts off from 6 and it goes down to 12. And also it's the middle 1/4 of the iliac crest, and also the it's a ligament right here, inguinal, I think it's inguinal ligament. So there's this ligament right here that it also originates from. And then it inserts at the iliac crest, the pubic symphysis, and the linea alba. And that stabilizes the vertebrae and increases intra-abdominal pressure when contracted. And so finally, I think, we have our erector spinae groups. And so this one, they all become more from laterally to each other. So the first one that's lateral, is a spinalis. Oh, so all of these are responsible for trunk extension. So first we have our spinalis, which is the first muscle lateral to the spine. And then the muscle lateral to spinalis is longitudinous, longissimus. And then the muscle lateral to longissimus is the iliocostus. And again, those are trunk extension. And I think that's all.